Hi, I'm Dr. Holly Lofton. I'm a board-certified obesity medicine specialist, and I direct the medical weight management program at NYU Langone Health. There's so much information about GLP-1 agonists as anti-obesity medication. I bet you can't think of one person who hasn't heard of them, and many of your friends or family members may have even tried them. However, I want you to be aware there are other classes of what we call the first generation of medications for weight management. If someone's not able to tolerate a GLP-1 agonist or unable to access it for various reasons, one of the options is a pill called Phentermine. This medication has been around for decades. It is an oral medication that's usually taken once a day in the morning because the way that it works is by replicating the hormone norepinephrine. And in doing so, people feel less hungry. It is a classic appetite suppression. It also gives people a little more energy, so they're able to increase their activity while creating a caloric deficit. And thus, this leads to weight loss over time. Now, this medication is different from the GLP-1 agonists, which are intended for chronic weight management, because the FDA has approved this for short-term weight loss. And specifically, it's recommended for no more than 12 weeks at a time. The medication comes in different doses from 8 milligrams to 37.5 milligrams, and it's usually slowly titrated up depending on tolerance and effect. Now, some of the side effects are heart racing, insomnia, agitation, and dry mouth. This medication, of course, is not for everyone. It is contraindicated in those with uncontrolled hypertension, cardiac disease, such as a history of heart attack, high risk of heart attack, or stroke. And of course, there can be some drug interactions, which should be looked at on a case-by-case basis. Phentermine may be an option for you or your patients if you're finding that you have an elevated appetite that's keeping you from losing weight. Of course, this should be used as an adjunct to lifestyle recommendations, which mean eating fewer calories and increasing our activity. Another non-GLP-1 agonist medication that is indicated for anti-obesity is called Qsymia. This is another oral medication that contains Phentermine as a main ingredient with the additional medication topiramate. And the idea behind putting these two medications together is that we could generate more appetite suppression without the high potential for side effects that I mentioned with Phentermine, such as agitation, heart rate increase, or blood pressure increase. Phentermine is an appetite suppressant, and Topamax is also used for migraine prevention or seizure prevention. And as a side effect of taking topiramate, people were losing weight unintentionally. So they decided to put Phentermine with the topiramate as one pill called Qsymia. This comes in 4 different doses and is usually titrated up from the lowest dose to the highest dose. And it's been found that people who can't tolerate the highest dose of Phentermine are able to tolerate Qsymia better because overall there are lower doses of Phentermine in Qsymia. This medication came to the market in 2012, and the sequel trial, which demonstrated its safety and efficacy, determined that it had about 12% weight loss, which for many years was the highest weight loss of any other anti-obesity medications on the market. Because this is a combination medication, it does still have some potential side effects and some contraindications. For example, we don't give this to people with uncontrolled hypertension or anxiety. It is contraindicated in those with glaucoma. And of course, we don't give this medication to anyone who's had adverse reactions or hypersensitivity to either of the ingredients. One very important measure to remember that is different than its counterpart Phentermine is because of the ingredient topiramate, this medication should not be given to anyone who has childbearing potential, meaning they're not using an active form or maybe even 2 active forms of contraception. The reason for this is the topiramate can increase the risk of having a baby with a cleft palate by 5 times if someone becomes pregnant while taking this medication. Again, the dosing is once a day, and one of the most commonly reported side effects is paresthesias, numbness and tingling of the fingers and toes, That can manifest as feeling very cold when it's cold outside. Most patients say that it's not so intolerable that they think they want to discontinue the medication. Now, there have been reports of vision changes with taking the medication, and if someone reports severe vision changes, it is recommended to discontinue the medication as well. The third non-GLP-1 agonist medication I'd like to discuss with you is called Contrave. It is a combination of bupropion and naltrexone. This is an oral medication that's administered anywhere from 1 time a day to 4 times a day. This medication is unique in that its mechanism has less to do with hunger control, but more to do with fullness. The bupropion portion of it goes to the area of the brain that signals satiety and makes the patient feel more full. The naltrexone part is very important and unique. It is an opioid antagonist, and this goes to the area of the brain that creates cravings and desires to eat. So for patients who recognize that they have emotional eating or are very triggered by, say, visual stimuli to eat, this medication is found to be very beneficial. There are also contraindications and adverse effects related to the two individual components. First, naltrexone should not be taken with any opioid-containing medications because it blocks opioids. So that's something to be very cautious with when prescribing and ask patients if they're taking any opioids. The bupropion aspect can have some interaction with many other medications, including some psychiatric medications, even antiarrhythmics or blood thinners. Some of the side effects that are reported are GI-related, and that can be nausea. And this is why the medication is slowly titrated up, usually in a weekly fashion. Specifically, this is found to be most beneficial in patients with emotional desire to eat. One other caution with Contrave: if a patient is up to the highest dose of Contrave, which is 4 pills a day, because of the potential for seizures with rapid withdrawal of the medication, specifically the bupropion portion of it, the medication should be titrated down and not suddenly discontinued. Now that we've discussed some of the non-GLP-1 agonist medications, I'll inform you about some of the efficacy that was determined in the clinical trials for each of these medications. So looking at Qsymia, at the highest dose, there was an average of about 11 to 12% weight loss over about a year's time. Various doses of Contrave generated anywhere between 6 and 12% weight loss in 2 different trials. And Phentermine had slightly less efficacy than Qsymia. Those trials are very hard to find because they date back to the 50s. Head-to-head trials of these medications have not been done, but if we look at our GLP-1 agonists, liraglutide generated between 8 and 12% weight loss in various trials, and semaglutide generated 20% weight loss in the landmark trial that determined its efficacy. So it's important for us to think about first the safety for our individual patients, the efficacy, and how well each individual drug can help our patients lose the desired amount or the necessary amount of weight, and then of course the accessibility. Are they willing to take it, and is it affordable for them? So this is the mechanism I use to determine which medication might be best for a patient at a given time.